About 2 years ago, my knees were bothering me just extremely. It got to the point where I couldn't run, I couldn't bend down, and when I bent my knees, my kneecaps would just kind of shoot out to the sides. And the pain that was associated with that just made it impossible to do just any everyday tasks. I talked to several people, and that have had different procedures, and Dr. Epstein's name came up, a few times. So I did some research, and I came to see Dr. Epstein. And at that time, he diagnosed me with what the problem was with my knees. And he said, well, first we're going to try many different avenues before we go into surgery. So first he had put me into physical therapy, and then he went to taping my kneecaps to try to get them in the place where they belong. He also looked at orthotics. We went through every aspect of anything that could be causing it before we got to the point of surgery. Unfortunately, those things didn't work, and we had to do the surgery. So he told me that we would do the surgery separate. We would do one knee first, and after I recovered from that, we would do the next knee. So we went ahead with the first surgery, and lo and behold, a few months later, after physical therapy, the knee did fully recover. And I would say it was probably about 8 months after that, we elected to do the other knee. We went through that surgery. Well, I went through that surgery, and I recovered even faster than the first knee. I guess it was because I knew what to expect a little more. And now my quality of life, I'm back to running. I can bend down, I can go up and down stairs. It's just a complete separate change. And the whole way through, Dr. Epstein would take the extra time, tell me everything through each step of the way, what to expect, what not to expect, what you can do, and probably what you shouldn't do. And he was right on all the time. So I am very thankful for everything that Dr. Epstein did for me.